So this is a quick video about 7 slides and its special considerations of medication administration. Some we've talked about, but I want to take the time to formally address them here. Now, at this point, you've watched the MedPass, you've done your dosage calculations, you've gotten a lot of things done. So this is making a lot of sense to you now. So remember when we were going over the med videos, I said that when the doctor writes an order, the assumption is that the pill's going to be given by mouth orally with water. Now, it may seem silly, but any other type of thing, you need a doctor's order. So do you need a doctor's order to give it with orange juice? Yes. Do you need a doctor's order to crush it and put it in pudding? Yes. And so we don't expect you to be pharmacists, but the reason we say that it is only with water is because there are things you could change the way the medication is, the way the body absorbs the medication. And I'll leave it at that. So for example, there are some medications that are not meant to be crushed. They are supposed to be dissolved slowly over time, over 24 hours. All right, these medications have abbreviations behind them, XL and or XR. And that's why when we did the practice test going back, I think to unit 1, I'm so much into these videos, I forget where, and we were seeing if aspirin was the same. I said, no, the doctor ordered aspirin EC and pharmacy didn't send you aspirin EC. All those letters behind the medication mean something, right? So for right now, again, we don't expect you to know all of what they mean. We just expect you to know that it's, unless the doctor says okay to crush a medication, okay to put it in pudding or do something else to it, that it's the expectation that you are going to give the pill whole with water, the person's going to swallow it. Any other deviation to that requires a doctor's order. Okay, you can give half tabs, and we went over this, but only if it's split by pharmacy, and that's a test question too. And so it looks odd, but it will come already halved in the little blister packs. And I'll try to see if I can find a picture. But that is a test question, okay? So when you're doing your med math quiz, which you probably already did because it's prior to this, that you you can give a half a pill, but you can't cut it yourself. So that is a test question. You're not allowed to cut it yourself. Now, these special instructions here, this is page 124 of your book. I'll give you a moment to get that. We're in your big book, Your Responsibilities in Action curriculum. And it is basically going over everything that we went over, okay? And HCP order is required to place the whole tablet of capsule in applesauce, to crush it. I'm going to highlight the crush because it has serious ramification or can actually cause harm to your clients if you start crushing meds that are not supposed to be crushed. So I'm going to take a time to especially highlight that, okay? And you need a HCP order in order to mix 2 liquid meds together. So all of these you could read here. Now there's a little, whenever this guy makes this little announcement, if a tab must be halved or quartered in order to administer the correct dose, it must be done by pharmacy. So I'm going to highlight the halved. You really don't quarter a medication. It's really hard to do, like nurses typically would have it. I would never quarter a medication because you can't say that the person got the entire dose. But that's neither here nor there, but this little section here drives me nuts. But again, pharmacy has to have the medication. So I'm going to have it. I'm going to highlight the pharmacy and the have. All right. You are not allowed to break, split, or cut a tablet. All right. Okay. And like I said, that's a test question. So this page 125, you all are probably sick of my Jeopardy sounds by now. So I am going to give you a couple minutes. Instead of it being silent like we've been doing, just pause the video, and when you're done and ready to hear the answers, hit play, okay? And so that's the beauty of this class. Everyone could work at their own pace. So this is a true or false, and you're going to read each statement and decide, put a T for true or F for false. Okay, let's go over the answers, and hopefully, again, if you're not done, just pause. Give your brain time to process the information. All right, you must contact the HCP to obtain an order if a person requests apple juice with their medication. This is true. A tablet may only be halved or quartered by pharmacy. This is true. Although, like I said, as a nurse, that statement bothers me a little bit, but I won't confuse you here. The answer is true. You may place whole pills in applesauce, yogurt, or pudding without an order. This is false. Liquid medications may be mixed together if ordered by the PCP. True, because it's if ordered by the PCP. I think this false isn't clear, so let me just write it out. False, so that it could be a little bit clearer for number 3. All right, false. And HCP order is not required to open a capsule and mix the contents with applesauce. That is false. You do need an HCP order, okay? So let me highlight what am I going to highlight? The true statements. True, true, true. So 1, 2, 4 are true. Okay. So now we keep talking about when to give meds, when to give meds. Let's spend a moment and talk about when not to give meds. And you do have a few test questions stemming from this. Don't say I never gave you anything. You cannot give meds if you cannot do the HCP order, if you cannot read it. So that makes sense. If you're going to do the check, you remember you have to read the doctor's order with the 3 checks. If you can't read it, you can't give it. If there is no doctor's order, and even if it's there, if it's not signed, you can't give it. If you cannot read the label, you can't do the checks. So if something's preventing you from doing those 3 checks, you can't give the order. If the label is missing, for sure, because what do you know what the pill is? Now let's focus on these two. Because although you may be like, oh, okay, I know I would never give it, but it's quite easy. Clients live with us for a long time. Hopefully you'll have your job for a long time. You make friends. Your colleague, you've become good friends, and they say, oh, I popped the pills already. They're there in a cup. It happens. I've been a nurse for about 13 years. Even nurses do it, and they know they're not supposed to. And it's a lot of pressure. What are you going to throw the pills out? You are not supposed to give medications prepared by someone else. And I spend time on this because I don't want you to get comfortable because you haven't done the 3 checks yourself. So instead of falling for the peer pressure, what you need to do is never do it, not even once. And then people would know that this is something you're just not going to do. All right. So they won't put you in a difficult position. Now, med seems to be tampered with. We'll show you what tampered with means in the next slide. The blister pack. If it looks like someone kind of popped it and then went back in there and tried to make it seem like it wasn't popped or fishy or something like that, you are not to give the medication. Okay, so all of those are reasons not to give. So here's what tampered with looks like. Here, it's scotch tape, so you can't see, but it's clear. See, a blister pack, this is what we call a tamper-resistant blister pack. That's why in the group homes, it's not in bottles like when you pick up your own medication from CVS or Walgreens. Anyone could open that bottle and take pills out, and you would never know that someone was in the bottle, right? But here, if you notice the backs here, these backs, no med has been popped yet, okay? They're designed so as soon as you pop it from the front and it comes out of here, you see that someone's been in it and took this pill. So what might happen, all right, is that someone might take a pill, right? Most pills are what? Little white pills. How are you going to tell one from the other? And might try to put in something different in there. So that's what it means when someone was tampering with it. All right, they were doing something they shouldn't have. Now, this is obvious. The back should never be taped up like this, but the Scotch tape is not so obvious. All right, if it comes to it's been popped, meaning it's been poured, there should be no pill there. It shouldn't look like someone tried to put the pill back and try to tape it back together. Okay, I hope that makes sense. Now, another reason to stop if everything we discussed before, and also you are uncertain the 5 rights agree. Like the tests we did, the aspirin EC versus the aspirin, it's a great one. If you have question now, they might agree, but you might have some confusion. It's fine. Ask somebody if there's another MAP staff, if your supervisor's there, or you could call the pharmacy. You could use your MAP consultants, all right? Now, say everything is right with the 5 rights, but your person can't swallow, okay? If they can't swallow, they can't swallow. You can't give them the pill, all right? So you're gonna have to document a refusal, and we'll go over on the slide. I did mention it prior that in order for you to refuse, the person has to refuse 3 times, 15 to 20 minutes in between. And the med was pre-poured, meaning somebody else poured it, prepared it, popped it, whatever synonym you want to use. These are all reasons to stop. The refusal is a test question, but we're going to go over that in detail some more. Okay? All right, that's it.